the main issues that are at stake. Some of them are related to general politics or health stakeholders, like clean air, which is a strong message that needs to be given. And some of them are related to, well, I reason as myself as a physician, a respiratory physician, as a researcher in the field, what can I do to improve this? Which means earlier diagnosis, which means spirometry for everyone to identify patient at risk, which is, and this is a particular relevant issue to me, comorbidities. Because if I consider that particular patient with COPD that I have discussed in the presentation are elderly patients with common risk factor, with patients with other comorbidities, cardiovascular, metabolic. If I know that they have COPD, I should proactively look at the other one, making it possible an earlier diagnosis and an earlier treatment of the other conditions. I think we are very much working in silos, and one of the main important message was the multidisciplinary or the coexistence and sharing knowledge and sharing methodologies, both in terms of education and platforms, but also on a practical standpoint, where seeing the patient, looking from a different viewpoint with different experts and different specialty together. The first impression I got is how underestimated are the respiratory diseases in general, but also how underestimated is the knowledge that I have outside my specific field of investigation and clinical practice. So this is a good example where knowledge and activities and clinical practice is shared, and a formidable way to go forward, to have everyone in the field of respiratory knowing that there is not only ESBIT, but it is much larger. Actually, the comorbidities between the different places are aggravating the situation. So intervening in one might be helpful for the entire respiratory, and I would say for the entire health of the person.